Today, we are having a necessary hard conversation. This Mental Health Awareness Month, I want to spotlight the healthcare crisis that impacts every single one of us, but we rarely talk about it. Healthcare worker mental health. Every one of us is impacted when our healthcare workforce suffers. You might think healthcare workers can access mental health care. What's the big deal? The reality is far from true. Trigger warning. This episode will discuss heavy themes, including suicide. Please give yourself the care you need. My guest expert today is Corey Feist, the co founder and CEO of Dr. Lorna Breen Heroes Foundation. We discuss the foundation's origin story and how it is providing critical support where it is desperately needed, from changing state legislation to removing the stigmatizing mental health questions that prevent clinicians from seeking care. Let me share some data points to put things in perspective. Every year in the US, we lose an estimated 300 to 400 physicians to suicide. Recent data from the 2025 Medscape Physician Suicide Report indicates that 1 in 6 physicians has contemplated or attempted suicide. Women physicians have a uniquely skewed risk. A landmark study in 2025 by JAMA Psychiatry found that female physicians are 53% more likely to die by suicide than women in the general population. For nurses, a 2025 meta-analysis found that the lifetime suicidal ideation among nursing professionals is as high as 44.5%. These are just a few numbers. Despite these risks, 41% of physicians report they are afraid to seek professional help for fear of disclosure to their medical board. This conversation that we're having today is critical for all of us, for you and me, but it's also deeply personal. So let's dive in. Welcome to Success Reimagined. I am Dr. Amna Shabbir, your host on this journey to thrive at the intersection of ambition and wellness. In every episode, I'll help you challenge outdated definitions of success, discover practical tools and strategies for growth without compromising your well-being. I am so glad you've joined me. Let's reimagine what's possible together. J. Corey Feist is a healthcare executive, co-founder and CEO of the Dr. Lorna Breen Heroes Foundation, and one of the most powerful voices in the fight for healthcare worker mental health in America. The foundation is named after his sister-in-law, Dr. Lorna Breen, an emergency room physician on the front lines of COVID-19 who died by suicide in April 2020. What began as a personal loss became a national movement. Corey's advocacy led directly to the passage of the first federal law focused on healthcare worker well-being, the Dr. Lorna Breen Healthcare Provider Protection Act, which has delivered over $110 million in funding to hospitals and healthcare systems nationwide and was recently extended by the Congress for 5 more years. Today, the Foundation's programs reach over 2 million healthcare workers, and as of early 2026, 70 state licensure boards and over 3,000 care facilities have removed invasive mental health questions from their licensing and credentialing applications, making it safer for more than 3 million healthcare workers to seek mental health care, without fear of professional repercussions. In 2023, Corey and his wife, Jennifer, were awarded the Surgeon General's Medallion for Health, the highest civilian honor the U.S. Surgeon General can bestow. He holds a JD from Penn State Dickinson School of Law and an MBA from the UVA Darden School of Business. Corey, welcome to the podcast.
Thank you so much for having me. I'm thrilled to be here.
You turned the most devastating moment for your family into a national movement. Take us back to when you lost Lorna. Who was she and what happened?
Lorna was an incredible physician and an incredible leader at New York Presbyterian Hospital, where she was running the emergency department at the Allen Hospital. Lorna was a salsa dancer. She was a snowboarder. She was a world traveler, and she was the crazy aunt to 8 nieces and nephews. She was always taking them places and having a great time. Lorna was very typical as a physician in some ways, though. In particular, was her fear for getting mental health treatment. And so in those really intense hours in New York City during days and weeks and months during the beginning of the pandemic, when the emergency rooms were overwhelmed with patients dying in the waiting rooms, clinicians who didn't know how to take care of them, Lorna contracted COVID and went back to work way too soon after being sick with COVID. Like within 12 hours of being afebrile, she went back in, but she was way too debilitated from her COVID to provide patient care. But nonetheless, just like the firefighters on 9/11, she ran back into the burning building. And it killed her. She pushed through with sleepless nights, already depleted, got herself into a position where her mental state was compromised from COVID and from the pressures that she was under. And we, as a family, got her her first and only mental health treatment of her life down in Virginia, where the family resided. And during her stay in the inpatient unit at the University of Virginia Health System, she began to articulate to us that now that she'd obtained mental health treatment as a clinician, her career was over. Everything she'd ever wanted as a child was done. And at the time, I was the CEO of the University of Virginia Physicians Group, which employs all the clinicians at the University of Virginia Health System. I was a lawyer by background. Her little sister Jennifer was my wife, also an attorney, and we were trying to really explain to Lorna that because of the Americans with Disabilities Act, she didn't need to worry about those kind of things. And yet she could not be moved off of that position and ultimately died by suicide just a few days after being discharged from her first ever mental health treatment. Our family wanted privacy in that moment of deep grief and shock. But that privacy was ripped from our hands by a national paper that or news outlet that published her cause of death over our objection 12 hours after she passed. In retrospect, that was a gift. At the time, it felt like the biggest gut punch I'd ever received, and certainly was not something that was welcome. And yet, at the time, because Jennifer and I were so concerned about health workers, we felt like it was important to warn the country that other health workers like Lorna were at risk of contracting COVID and then coming back too soon and potentially having the impacts of COVID on their cognition. And just, we needed to protect them. And so we started to share Lorna's story um, to highlight an incredible woman who gave everything of hers and died at the age of 49 because of the workplace conditions that she was working in. When we began to speak out, and frankly, after that initial news coverage, then a flood of feedback came to us. And that feedback did not relent for 3 years. Every day we were hearing from people that we didn't know the day before. And after hearing from that initial flood of feedback for about 4 months, we said, okay, we cannot ignore this. We need to do something for the healthcare workers who are left behind. And so we named the foundation after Lorna, but the foundation isn't for Lorna. It's for all the health workers in the United States, really focusing on improving their workplace conditions so that they can thrive as whole humans. And the Lorna Breen Foundation has really stepped into this arena and stayed into this arena since our inception and made a big impact, albeit we've got a long way to go and not as big of an impact as we haven't solved the problem yet, but give us some time. We're going to be working in this very collaborative way across the healthcare industry to lock our arms around healthcare workers and say, we see you, we hear you, we are here to help you create a better day. And because you deserve it. And that's a little bit about our origin story and a little bit about our focus as a foundation.
I know this story and I know the background. And every time I hear it, like you just shared, I am experiencing, I would say, a rainbow of emotions right now. I have to just acknowledge that. And this very visceral reaction to that impactful share. I know that many people in my audience right now are outside of healthcare. And that's one of the reasons I wanted to spotlight and share this impactful journey and the impact that you're creating, because a lot of times we don't even know what's happening with healthcare workers behind the scenes. I mean, obviously they can get help, right? But no, there are so many barriers. And I'm going to pause here and share a little bit about my story. When I parallel found out about the foundation, this was a couple of years later, but I will say I'm a proud ambassador for the foundation since 2024. And I experienced severe postpartum depression and anxiety both times. I have two daughters. First, it was during residency. The second time as an early career physician. One of the most visceral responses I had in that pit of darkness, and that included thoughts of suicide, which I continue to not talk about that up until last year. Like, this is how long it actually took me to even talk about it. Was this fear of being discovered, the fear that my image as a perfect physician is going to be tarnished because I would have to report it everywhere, that my credibility as a doctor would be in question. So I lied on my depression screenings. Things got really dark before I sought help, and I'm so glad that I did. And I'm here today to have this conversation with you as an ambassador of the foundation. I feel like I finally found the language to share this story and channel it for impact. When you were talking about Lorna, I mean, you heard these stories now, that floodgates that opened 3 years after. Can you explain how licensing and credentialing questions have actively prevented healthcare workers from seeking help and what the
Absolutely.
foundation is doing regarding
Absolutely. And I just want to thank you for sharing your story. Our chief medical officer shares her very similar story that she had because she had children during her residency and had to hide her postpartum depression. We hear this from everybody because, as it turns out, clinicians are human and you are susceptible to the same conditions, whether those be mental health or physical health conditions that anybody is. And it's an incredible injustice that you are not able to get mental health treatment. And let's talk about that for just a second, because for me, as somebody who was a non-clinical healthcare leader, so I was not clinically trained, but I was in healthcare, the issues that Lorna was talking about for me, as someone who was that close to it, were a shock. And so for someone who's not in healthcare to hear you can't get mental health treatment, you prescribe it all the time. What do you mean you can't get it yourself? Let me go into it a little bit. So, healthcare workers have to navigate a minefield of questions about their prior mental health treatment and diagnosis throughout their career. It begins, frankly, when they apply to graduate school, for medical school or nursing school. They often are asked questions about their mental health and often encouraged not to disclose anything about their mental health in that application process. And when they become, we'll take physicians for a second. When they become physicians, um, you get a license in a state. When you apply to get a license in a state, the licensing questions may ask you inappropriately, have you ever gotten therapy? Have you ever been treated for a mental health condition? Shockingly, those questions are often listed in categories that you would refer to as moral fitness categories, like, have you been convicted of a felony? Have you gone to mental health treatment? Like in that order. And so there's a real message that those questions send, even the way that they're listed and where they're listed, that getting mental health treatment is not okay. So then you get that license, and then you need to go to work in a hospital system. To do that, you need to apply to work in that system, and that's called the credentialing process. And that process is a similar kind of a vetting, and they ask very similar questions, but they don't just ask it of you, they ask it also of your peers. They ask those same or more invasive questions. Have you ever known Amna to have X, Y, or Z? And they're very gray in the questions, and they're very broad as well. And so that's another layer. You wanted to get paid for your work. Did you, Amna? Okay. You need to apply to get credentialed by an insurance company so that they can pay you. Similar set of questions. Oh, you wanted malpractice insurance. Similar set of questions. So the questions go on and on and on, which is why I say you're navigating this minefield of questions. And it continues to reinforce the message that you have, which is it's okay to take care of others, but you're not really allowed to take care of yourself. And what we need to recognize in all of that is the fallacy is that you would have been a better clinician if you had been getting treated for mental health when you needed it. It is actually unsafe, not just for you, but also for patients, for you to be ill of any condition, frankly. We want our healers to be well. We want them to be well rested. You think about it in the context of aviation. I can't name a person who hasn't had their flight delayed because the flight crew timed out and had too many hours working that day. We don't have anything like that in healthcare, but it's really important to land that airplane rested and similarly take care of patients, in a rested way. Frankly, it's shocking to me that these questions exist. The good news in all of this is that we've identified a solution which is free to every hospital system and licensing board and malpractice carrier and insurance company in the country. And that's what we call the All-In Champions Challenge for Licensing and Credentialing. And these are resources that we provide under grants. So it's free for any applicant to review what they're asking against best practices, change those things, and then submit them to us for verification. We have volunteer lawyers and paid lawyers who are helping to validate these questions and fix this problem. In some cases, this problem can be solved in 48 hours. That was our fastest. We gave an organization feedback on a Friday, and by Monday, everything was fixed. So it's a very solvable issue, and it's one that goes beyond just making the change, though, because as you shared, you were very concerned about a number of things in your journey. If we don't let you know that the rules are changing and what the rules actually are, how can I ever expect you to make a different decision next time you have a child and you have postpartum depression, which you know is something that you're going to likely have if you decide to have more children, as an example? Like, it's just, it requires us to do those two steps, change, then communicate, which is why we have published a set of maps for the country, which we believe is a source of truth. And as you noted, we now have this program implemented so that it is benefiting 3 million health workers. And we do that through a badge we give out to each one of these organizations so that the healthcare workforce can look and see and say, you know what? This isn't a place where I need to worry about getting repercussions for getting help. I can get help here. And so improving and increasing the access to mental health care is huge for us because as it turns out, you deserve it because as it turns out, you're humans, just like all the rest of us need to be taken care of.
So many thoughts, but I loved how you said change and then communicate with this fantastic program. And that's part of the message that we're trying to do today. And as I learn more about the foundation, I'm reflecting actively right now. This was not a reflection that I feel that came to me prior to that. I feel that being an ambassador has actually given me the courage to share that I did not know before because my courage is rooted in facts. It's rooted in the numbers that you're sharing. Because,
Yeah.
I mean, I talked about my postpartum depression, but I never talked about the fact that I was having thoughts of hurting myself. And last year, I interviewed with Medscape. So an article came out,
Yeah.
and although even at that time, we didn't openly talk about it, but the title of the article was When Physicians Die by Suicide. And so, although, like, who's reading the fine print, right? So the article made it sound like that. And then I looked at the amazing work the foundation is doing. And I said, you know what? What if I actually just shared this? Like, what would happen? And I am also part of the North Carolina Medical Society's Clinician and Wellbeing Retention Consortium and doing the work with them. And I feel it was an impact of seeing that it is okay. And while there is all that well-intentioned change, if it's not communicated, it doesn't work. And of course, like as I'm working with other organizations, there is this resistance as well. Like I feel people still look at you different if you talk about mental health, but we are like talking about so much positivity that is being created out of something that was so devastating.
I agree. And it's amazing to me, we just surveyed actually, I don't know, hundreds of organizations that we've given the badge to, and we asked them about their experience. Notably, not one respondent identified a negative impact of making the change. I mean, that's who doesn't point out something negative, right? Nope, not one negative piece of comment. In contrast, the feedback that we're receiving is not only is this making it clear to our workforce that it is okay in this institution to get mental health treatment, but it's also changing that underlying culture, which is part of what your story is rooted in, right? You were sharing just a moment ago with me that you were concerned about, I'll call it the reputational risk of not appearing perfect. And it breaks my heart because who's perfect? And B, we have to change the culture at the same time we're changing the rules, or changing the rules didn't matter, right? And so that's incumbent on all the clinicians to look at each other in a different way, look at themselves in a different way. It starts by looking at yourself in a different way, but then looking at each other, because we did a survey a year ago, a different survey a year ago, which identified two really important things. One is that about half of the healthcare workers, nurses, and doctors in that survey were saying, I'm not going to get mental health treatment because of this issue. That was one of the big findings. But the other was that the fears are of what others would think of you are greater for getting mental health treatment are greater than the fears of what you think of others for getting mental health treatment. So it's this inverse thing here. And it's this narrative that we have in our heads, which is it's okay if Amna gets mental health treatment. Of course, I wouldn't think any different from her. But me, if I get mental health treatment, she's going to think something different of me, or potentially my boss, or the leader of the organization. It's going to be a sign of weakness. You know, I call BS on that. It's not a sign of weakness. It's a sign of taking care of yourself so you can continue to thrive. And that is not weakness. That is just part of being human.
I absolutely loved that reflection because, in parallel, there is this other journey that I've been on, and that's been trying to understand perfectionism because I feel that in healthcare, what we do is we have this expectation of perfection. So there, not to get too like deep into this conversation just on perfectionism, but there is an element called socially prescribed perfectionism. It's a type of perfectionism. It is a perception that everyone demands us to be perfect, like society, culture, random strangers online. And I feel that this is so magnified in medicine because what has happened is the oath does not say do no harm is an absolute. It says try, like there's no try to do no harm. It also, there is in the Hippocratic Oath is like this specific care that you have to give to your own well-being as a clinician, as a physician, and we forget all that. And so when we want perfect outcomes from clinicians, we dehumanize them. And when we dehumanize our doctors by asking, and doctors, nurses, our entire healthcare force, when we ask them to have perfect outcomes every single time, we dehumanize them. And when we dehumanize them, then they are, of course, going to inadvertently dehumanize the care that they're providing in their communities.
Yeah. We have a lot of work to do. And it starts by your own sphere of influence and control. The way that you're talking about it. I mean, as you've just shared today, you're now talking more openly about it. I'd be curious. I know you're supposed to be asking me the questions in this, but has anybody come to you since you started to disclose it and say, oh, this is a problem? Or
No one.
have people been supportive, right? And so sometimes it's that first step, right? That leap of faith, if you will. It shouldn't have to be a leap of faith to disclose it in healthcare. But that's what we
Yes.
continue to hear. And there's little examples that I've seen over the years of doing this work now where, somebody on their signature block on their email will just say in therapy since X day or on XYZ, medication since Y day. And you go, okay, these are little ways that we can normalize this conversation. Another really, I think, to me, a glowing indicator that we're onto something here is that many organizations now are going to what's called opt-out scheduling for mental health treatment for their workforce, and it often begins with the residents. And what they'll do is they'll schedule the entire block of residents for a single mental health treatment. Everybody. They can change it. They can not go, but every organization that I'm aware of that has implemented this not only has seen huge initial utilization of mental health, but the ongoing utilization beyond that first step has been much greater than they would have ever expected. And so that show that it's just like it's a perfect example to me that it's like if you build it, they will come. If you use it, you will continue to use it because you will see the benefits and that it is not a scary thing. It is actually a very beneficial thing. And you can be a better clinician by doing it and taking care of yourself. I when we started this in very early days, I recall, Lorna had two physical issues over her two or three. One, she tore her ACL, MCL, all the L's, all the A's, whatever, in a snowboarding accident. She told everybody about that. She was, rolling herself around the ED, on one of those trolley thing. I don't even know. I'm sure there's a technical orthopedic surgeons who are listening to this. Are like, "Oh, Feist, you're awful," but you know what I'm saying, right? So she's rolling herself around, but she told everybody about it. Same thing. She came back from a long flight and then ran a half marathon in New York. She diagnosed herself with a pulmonary embolism when she was running that. She admitted herself to an emergency department. Actually, it was not the one that she worked in. It was a different one. It was just close by to the race. She actually directed the resident on how to do the exam on her, but she told everybody, "Yes, I diagnosed a pulmonary embolism because I was on a long flight." She had no problem telling them. Now, when it comes to needing to take a break to get mental health treatment, wouldn't say a thing. The fact that she got mental health treatment, it had to be a state secret. And it was so stigmatizing for her and such a burden for her that she couldn't see a way past. So again, I'd like to point out that Lorna's story is not unique. Lorna's story is one of thousands of stories that we've now heard, literally thousands of stories, which is why we know that Lorna's a great example of this, but she is not the exclusive person that this has happened to. I mean, you just shared your story as a perfect example of that. And So I think that we have a long way to go. We've made incredible progress here. And this is one of those things where, I know a lot of the listeners are patients, obviously. If you're not a clinician, you're ultimately a patient at one time or another. So what can you do as a patient? One of the things that you can do as a patient is you can go next time you go see a nurse or a doctor or another health worker, ask them how they're doing. Thank them for doing their job. Let them know that they are seen and heard as humans. And I think that it's that changing of the discussion to be one of supportive of those who are giving so much of themselves for all of us that needs to happen. And each one of us can play a really important role in doing that. As you know, you mentioned the Lorna Breen Act in your opening, but we designated March 18th, which was the day that the president signed the Lorna Breen Act into law, as National Health Workforce Wellbeing Day. And there are people that are taking all sorts of actions around the country on that day to celebrate health workers. We just saw a great example outside of some clinics where students in high schools were using chalk on the path that health workers were taking into work that day, just thanking them with gratitude and appreciation. What that did to those health workers on that day was to make them feel more human, more appreciated, more heard. I guarantee you it resulted in better patient care that day because they just felt more alive and more full. So again, everybody has a role in this work. Everybody can make it better for our workforce, which ultimately comes back and benefits them in a time of need as well. It's a journey we're all on together, and we're honored to be on it with you. And I should have also said thank you so much for being an ambassador of our foundation. You've contributed so much already, and we're so grateful for all of our ambassadors, and particularly you, for using this platform and also really engaging in this work and helping us be a better organization by doing so.
Thank you so much, Corey. I really appreciate all those reflections that you just shared and just the simple ways, like you said, that we're all on this journey together, right? Whether you're a clinician or you're a non-clinician, if you're not a clinician, you're a patient. And I've been a patient and I've been on both sides of the exam table. It's not fun. And you have all these thoughts that are running on in your head. If I had not been a doctor, I mean, there are times when being frustrated as a patient, I mean, I have to remind myself, well, this person probably didn't sleep, or, what happened, or like this resident, look at how look, what's going on with them. And so I understand our patients are also finding themselves in these spaces. They're frustrated, they're tired, and so are our clinicians. It's almost like a breaking point, and adding that kindness and compassion in those moments can be so huge. So I appreciate you sharing that. And you made that earlier point about the residency programs. I want to touch on that, making this like seamless integration for everyone to access. And I want to give a shout out to my program director, Dr. Abby Spencer. She is incredible. When I was expecting my first daughter, I was also simultaneously given a serious health diagnosis. I potentially could lose my sight during the time I was, I was having her. So it was like, okay, now we have 9 months. I can't take medications. We're going to do all these testing, treatment, keep an eye on things. And during that time, she came up to me and she said, Amna, you have to go talk to somebody. And I took that as a personal slight. I said, what have I done to show you that I am lacking in some way, that I need to talk to somebody? And she said this, if you don't talk and process this now, this will, come back and this will be like not a good thing for you later on. I look back and I was in counseling sessions here and there. First time I just went and I sat in front of the counselor. I said, I really just am here to check a box. Fast forward, my daughter is fine. She's 9 years old now. I look back at that moment and that extremely stressful period in my life, and I have no residual like trauma from it. I look back and this is an example of what happens when things go right. Like this is okay.
I love that, and you're exactly right. And because you are a parent, I will ask you: have you ever read the book "Going on a Bear Hunt"? Do you know this book? Did you ever
Yes.
read this book? Okay, so
Yes.
I'm gonna use a phrase from that, which somebody gave me early on in our grief journey, which was, "You can't go under it, you can't go over it, you gotta go through it." And they were talking about getting help in that time, and I think that was such a poignant reminder that you can't outrun this stuff. It's gonna catch up to you one way or the other. So you can't go under it, you can't go over it, you've gotta go through it, and when you do, you can thrive, and all can be better, and I think that's the point. We get so afraid of what we don't know, and we get so afraid, especially if you don't have exposure to it, which is actually why I love those residency programs that are giving that kind of early exposure. And we've heard from medical schools as well and nursing schools as well that are giving that early exposure to the health professional students. So it's not scary. That's part of destigmatizing it in
Absolutely.
the first place and changing that cultural norm. And I would also just point out that when we think about cultural norms generationally in particular, the current generation of health professional students across the country has a way different expectation about how mental health is discussed and what workplace conditions are acceptable to them. And they're much more vocal about both of those topics. And so we have to change because they're not going to tolerate it. And that's not a sign of weakness. That is them actually educating us so that we can be better. They're helping us advance faster than we would have otherwise done on our own.
And I know that some leaders are getting frustrated with that desire that the younger generation has, and I actually commend it, just like you're saying, they're just not tolerating it. And for them, they need to have this. I feel this is a moment of bridge building instead of creating a divide. I want to pivot and go back to a
Mhm.
specific point of the conversation and sort of double click on it. We're talking about perfectionism, and I was curious if you feel comfortable answering this question. Do you think that Dr. Lorna Breen was a perfectionist, or was perfectionism showing up in her life in this overall or in that moment when all of this was happening?
I think she was very this is why it's funny when I talk about Lorna, she was incredibly unique in so many ways and very typical in others. What I heard from her was what I was hearing from thousands of doctors at the University of Virginia at the time. And so it really wasn't any different. It was this excellence at all costs kind of a mentality. And that was I think that's part of the as you had our chief medical officer, Dr. Stephanie Simmons on here last year, what Stephanie talks about is the toolkit of success to become a physician is way different than the toolkit that you need to take care of yourself. In fact, the toolkit to be successful as a physician is often not about taking care of yourself. It's about this perfectionism. It's about outworking everybody else. In many cases, to get to medical school and through medical school and then residency, it's also a very individual effort. It is not necessarily a team based effort. And so Lorna had all of those trappings, whether those were learned or the way that she came here. I would also say she was the strong. I mean, I would say this. My wife's not in this room. Hopefully, won't listen to this. She's the strongest person I know on the planet. This was not about a lack of resilience for her. But yes, she had that same drive to be the best at all times. She also recognized the failings in the healthcare delivery system and actually published on burnout and improvements in the operational redesign efforts that need to happen to reduce burnout. She published on it about 4 months before she died. So she was very aware and had a very much of a continuous improvement mindset when it came to the systems. She was also trying to improve herself by getting her MBA at Cornell at the time. So she was this driver of excellence, absolutely. And I don't see her drive for excellence or perfection really any different than almost any other physician that I know. I think it's part of the phenotype as well as it's kind of part of the conditioning that you've already discussed today.
Thank you for sharing that. I appreciate that and kind of holding space for the brilliant human that she was and honoring her memory and everything that, we're doing. And I always struggle to come up with the right words, and I'm the host over here and I should know what to say. But truly, it's like I can feel all the feelings in my body right now. Like she was such a brilliant leader and she cared so much for so many. And today in her honor, we're having this conversation.
Yeah. She was awesome. She was really missed.
Yeah. Congress has recently extended the Dr. Lorna Breen Act by 5 more years, but without funding, it's not worth much, right? So I would love to hear your thoughts about what can we do? Like, we know this is necessary for our entire community, for actually the entire country. And I will say that the impact that the foundation is having is actually spreading to the entire world, I would say, as a model for physicians that are suffering everywhere across the planet. So, what can the community do to support Dr. Dorna Breen Heroes Foundation right now?
Well, thank you for raising that. So the Lorna Breen Act is not a funder of the foundation. It is a funder of grants to hospital systems across the United States. 2/3 of the funding goes there. A third of it goes to help retrain healthcare leaders. And what we found in the first iteration of the law, which was signed in March 18th, 2021, was that organizations that received grants from the Lorna Breen Act decreased burnout, decreased depression, decreased turnover compared to organizations at the time that didn't receive grants. And so we know that the funding, which allowed them to create tailored solutions within their own hospital system to meet the needs of their workforce beyond resilience training, moving to operational redesign, was absolutely critical and impactful and needs to continue. We also have heard from organizations who have implemented the Impact Wellbeing Guide, which was the other arm of the Lorna Breen Act. This is the leadership retraining. They have seen similar positive impacts. And so, as you noted, Congress just extended the law through 2030. The process now every year will be to ask Congress to fund the law. And what we need folks to do is to reach out to their member of Congress to literally say, please prioritize the funding of this law. Almost every congressional district in the United States has a hospital system, or certainly if they don't have one right in the district, their constituents are going to a hospital in a different district. And so this is everybody's problem. And what we know is that the Lorna Breen Act programs work, and in their absence now, because they've been dormant for about a year because the funding ran out, and then through the change in the administration, there was a lot of hiccups in the process. Say, we're hearing from organizations that received funds prior that they've had to sunset their programs or, let people go. And it couldn't come at a worse time because, what's interesting is Congress started to pay attention to this during the pandemic when all of a sudden everybody was paying attention to healthcare and the healthcare delivery system at a different level than they had before, particularly health workers. But the workplace conditions now are worse than they were during COVID. And, oh, by the way, all the data shows that the burnout of health workers wasn't created by COVID. COVID gave us a lens that this was happening, but it way predated COVID. And a lot of it was driven by the administrative burden that's carried by health workers. Now there's additions to that, like violence and threats against health workers, all these other things that make their job worse. So you can go to the Lorna Breen Act, the Lorna Breen, Foundation website, and the Lorna Breen Act page on our website, which is very easy to find, and you can send a message to Congress. So that's the very first thing. The second thing is if you are a clinician and you are part of an organization or you are part of a professional society, let your professional society and organization know that they need to do this. I mean, that they need to contact their member of Congress and let them know about the Lorna Breen Act. We have over 75 different national organizations that have signed on to extend this law. This law is not controversial. It is completely bipartisan. It is both supported by Republicans and Democrats, and it is also bicameral, meaning it is supported in the House and it is supported in the Senate. And that's why it was extended until 2030. But without funding, the extension is effectively meaningless. And so we've got to take two steps to this process, just like we have to take two steps to the Champions Challenge process. Step one, get approval to extend. We've got that check done. Step two, every year we need to ask Congress to fund it so that the work can continue. I recently testified before the Senate Committee on Aging, and in the research for that, we identified that in the next 10 years, our healthcare at our current burnout rate of healthcare workers, we will be short as a country 500,000 health workers between nurses and physicians and pharmacists and others. We cannot afford as a country to sustain that kind of a loss of workforce. We will not have a healthcare delivery system in the United States if we don't have a thriving workforce. And the Lorna Breen Act programs are really a critical step in helping to ensure this work force continues to have thriving careers and take care of patients.
Thank you for sharing that, Corey. And I have done this. I mean, I'm going to link all of the links to go and click in the show notes. So wherever you're watching, listening, you're going to be able to do or we're requesting you to do, reach out to your representatives in less than 2 minutes. I've actually done it. And it's a very seamless process. And that's all it takes for you to create that big impact that we're requesting, which is, in a way, sounds selfless, but is also pretty selfish. I mean, I'm looking at it through the lens of a patient and a caregiver. If something happened to my pediatrician, I mean, she is both my kid's pediatrician and my psychiatrist, I feel like. I will be like not in a good place. And so it is about saving lives of healthcare workers. Those are the people that are going to save our lives. So while this might sound very selfless or altruistic, it's really not. It's pretty selfish. So to take care of yourself, please click that button. You'll find it in the show notes and do the thing. Thank you so much for your time today, Corey. I know you're busy spreading this incredibly important message. What would be your final take home points for today for our audience members? And again, you're listening to everyone, clinicians, non clinicians.
I think my biggest message comes from what we've learned. And what we've learned is that changing healthcare to support the mental health and well-being of our healthcare workers, as well as to benefit patients, is achievable. We have incredible momentum, and there's a lot of work to be done. And so I would encourage everyone to try to get involved at some level, either joining our ambassador program as an individual or having your organization think about joining our All-In Wellbeing First for Healthcare Coalition. Get involved in some way, even if that is limited to thanking a healthcare worker the next time you go in to see for an annual visit or for any kind of visit, giving a healthcare worker and the healthcare delivery system a little bit of a break here and recognizing that your care may be delayed because of the workplace conditions that healthcare workers are experiencing right now, not because healthcare workers don't want to take care of you. So give them a break. They need it. Check in on them. Check in on yourself if you're a healthcare worker who's listening to this. Check in on a colleague and understand that the system is what is broken here, not the individuals. When an individual needs help, get it. But this is a very solvable problem that we have great momentum in addressing, and we can do this together. And it's critical that we do this in a way that locks our arms in an interprofessional way around the workforce so that they see and feel that change occurring. And I want to thank you so much for being one of our ambassadors. I know I mentioned it before, but it is an incredible honor to walk this path with you and all of our ambassadors who have taken their time to say, okay, we want to be part of this solution.
Thank you so much for sharing that, Corey. And it is an absolute honor to be an ambassador. I want to give a special shout out to the entire team that works tirelessly behind the scenes for Dr. Lorna Breen Heroes Foundation, Dr. Stephanie Simmons, Dr. Ariel Arguelles. I think I messed up her name again. Melissa, everyone's doing so great. And I really, really value everything that you do. Thank you again for your time today.
You got it. Thank you. Have a great day.
You might believe you don't have the time or energy to focus on yourself, but this is exactly the right time to get serious about your well-being. You don't have to do it all alone. I'm here to help. If you enjoyed this video and are ready to take the next step, head over to dramnashabbir.com where you'll find free resources you can access right away. The website link is below. Let's get started on your path to thriving.